Dr. Kristjan Thompson acknowledges that he looks young and that occasionally he gets questioning looks from his patients. But he has years of education and training behind the disarmingly youthful smile.
I'm a second-year resident, and as of a month from now, actually, I start my third year of residency. I'm in the FRCPC Emergency Medicine program, the Royal College program. So I've completed 3 years of an undergraduate science degree, a medical degree, which is 4 years. I also got another Bachelor of Science degree during my medical school called a Bachelor of Science in Medicine, which is a research degree. And now, like as I said, I'm approaching my third year of residency in the emergency program.
I asked Kristjan if he always knew he was going to be a doctor.
Oh, absolutely not. No, I sort of was all over the board. I knew that I really like science, and I was always a bit of a science geek growing up, so playing with science kits. But I always had to bring a barf bag with me to dissection classes in junior high and high school. So I thought that medicine would be the last thing in the world for me. I did some work at Concordia Hospital, some volunteer work in the emergency room there actually, and did some research work in my undergraduate years at the University of Manitoba in medical microbiology, infectious diseases. And more I started to sort of see the light, so to speak. My mom always encouraged me to think big, and I loved everything, so I always knew I was going to be a professional student, and I really enjoy interacting with people, and so for me, it was always a matter of don't limit yourself, always aim for things that challenge you, that are exciting, and I never wanted a dull day at work, and so I think either or would have been fantastic, but I'm very happy with my decision, and I wake up every day and I love coming into work.
The first few years of medical school involved lectures and classroom learning, small group sessions, and labs where students learn basic clinical skills.
In our third and fourth year of medical school, that's where we get the hands-on practice. So we rotate through different specialties, including internal medicine, surgery, obstetrics and gynecology, psychiatry, emergency medicine, basically all the main specialties in medicine. We spend a month or sometimes 2 months in those specialties, basically rotating through and getting clinical exposure and experience.
In that last year of medical school, students apply for a specialty through the Canadian Residency Matching Service.
It's a whirlwind experience. You travel the country doing electives, so different exposures at different hospitals across the country, but you basically decide on 1, 2, 3 specialties that suit your disposition or your personality the best, or something that you could see yourself doing in the future. You apply, so again you have to beef up your resume, get all that set up again, and essentially it's like a job interview where you feel like a rock star. You're sort of living out of your suitcase, going city to city, applying for these programs and interviewing, and then it all gets put in a computer. You rank the places, the cities and programs that you like the best. Those programs will also rank you. It goes into a big black box, a computer system that sort of groups people with, it's an algorithm, and I mean, don't ask me to explain it to you because I can't. It's a black box to all of us. But at some day in May, we get an email basically saying, this is where you'll be for the next 5 years of your life or 2 years of your life. So
really?
It's quite a nerve-wracking experience, but every medical student in Canada does have to go through the process. And so for me, it was emergency medicine that I had applied to, and specifically emergency medicine here in Manitoba.
And so you got your first choice.
I did. I was very lucky. Yeah.
Now, was that partly because your family's here that you wanted to stay here, or was it the program itself?
For me, obviously, family was a primary consideration. My family lives here. The program itself is a very strong program. I would say one of the best in the country. We have a large catchment area, a very diverse patient population that present with very critical and acute medical problems. So we get great experience here. The pathology we see is second to none. And the group itself, the residency group of 20 plus residents, are very cohesive. We're all laid back, relaxed group that get along really well. So those are all sort of draws for me for staying in Manitoba.
You do get some pretty traumatic things happening here. Is there ever a point where this starts to make you afraid, when you start to think, oh, this could happen to you?
Oh, absolutely. I mean, I went skydiving before I was a resident. I will never skydive again. You couldn't pay me enough to get in a motorcycle, ATV. I mean, obviously, I still like to, do fun things, but I've seen so many injuries. Ladders. I'm going to be triple checking my ladders from now on. You see, and you get those funny stories and not so funny, very serious stories of silly accidents that do happen, and so it definitely provides a more acute awareness of safety precautions. Wearing your seatbelt, wearing a helmet, things that sometimes are neglected, and you see the devastating consequences of those. So I'm constantly reminded and exposed to these injuries, and so for me it's something that I've become much more of an advocate for because of that.
You don't have any children yet?
No, I don't, no.
But when you do,
yes,
or if assuming that you do, you'll be a little bit of a different kind of father, perhaps.
Yeah, maybe I won't be quite wrapping them in bubble wrap, but something close to that. Yeah. For me, it's almost a daily occurrence why I'm reminded. What I do is just fantastic. I do a lot of counseling to junior high and high school students, and I always tell them, as long as you wake up in the morning and you're driving to work, or you're busing to work, you're walking to work, and you just love what you do and you're excited to come into work, that's all that matters. And for me, that's every day. It doesn't matter. It doesn't matter what I'm doing, as long I'm actually surprised they pay me for what I do. I love coming to work. I love what I do. It's a fantastic thing.